The Health Mastery Café is recorded live and produced by DMMD Studios in Atlanta.
I was praying. I'm like, Lord, don't let my mother have to bury a child.
Next on the Health Mastery Café.
Some people still think that they'd rather get the virus than to get a vaccine. You think this stuff is way overblown, this coronavirus stuff. You think that you'll be fine if you happen to get coronavirus. Well, think again. In this series, I speak to everyday people who have had it and the people who are on the front line fight against it. Why you don't want COVID-19 from people who had it and the people who fight it.
Find The Good Dr. Dave on Instagram, Facebook, and Twitter, and subscribe on YouTube at The Good Dr. Dave.
Everybody, I'm really excited to have Sandi on the show today. Sandi, my friend.
Hi, Dr.
How are
Dave.
you?
I am doing well. How are you?
I'm doing great. I'm so excited that you've spent some time with us tonight. Would you start us off by just giving us a quick, who is Sandi? Tell us who you are.
Well, my name is Sandra Carothers, and I am a native of Atlanta, Georgia. I own a call center here. So I hire independent contractors to work from home with my company. And I also do golf tournaments as well. So I have a company that does that as well. So
Yeah.
Lady and Caddy is my golf tournament company, and SAS Global Solutions is my work from home company.
SAS Global Solutions, work from home company. You
Yes.
help those people kind of get out and still have a life, but still be able to kind of work and help people at Fortune 500 companies, large companies, small companies everywhere.
Yep, Fortune 500 and 1,000 companies. And the company actually took an extreme boom in 2020 because of the pandemic.
Yes,
People
so
were-
timely.
Yeah, it was. It was amazing. It was right on time. So a lot of people were interested in working from home, for the obvious reasons. They didn't want to be around other people and expose themselves to the virus. So this was a way that they could, earn income for their family and be safe at the same time.
Yeah, an idea whose time has come. I mean, it was like right on time. That's great.
Yeah.
So, I want to delve into this, Sandi, and I'm so glad that you agreed to do this. It does take, a bit of courage to do this. I want to tell your story about your COVID experience.
Yes.
Can you take us back to when you, first thought to yourself, oh, like this is COVID?
I know.
Tell us about what that was like for you.
Well, okay. So I was afraid of COVID just like everyone else. I was watching the news and I was like, oh my gosh. I think it was Seattle, Washington, where it first hit the US. So I was glued to the television, seeing where it was going to spread to next. And so when it hit Georgia, I was petrified. But in that same vein, I still wanted to get out and socialize at the same time. And it was during a time where the masks were not, a mandate, and people weren't even thinking about wearing the mask, right?
Yeah.
So right around the May, June timeframe, I started getting out a little bit,
So this was after the shutdown, after everybody got really scared and bought up all the toilet paper.
Bought all the toilet paper and Lysol.
And the Lysol. You couldn't find Clorox to save your life.
Nowhere.
And the numbers started to come down, but then it opened back up again. This is when you're talking about.
Yeah. So I said, I thought to myself, if I'm going to get out and socialize, let's do it in an open space, like maybe a patio or something like that, where, you're outdoors, you're not around a whole lot of people. And I would do it in an environment where the restaurant, for example, was very conscious about keeping people distant from each other. So I did that. So a friend of mine and myself went to just a patio restaurant, and we invited one other friend to come with us. And
this was the first time that you had been out in that situation since the
Yes.
lockdown? Okay, good. Okay.
It was the first time. And so we were like, okay, that was not bad. So we did it again. And so the same three people went, and then we invited another person to come. So it was four of us at a table outside. And they were still social distancing at the other tables. Um, three out of the four people at the table got COVID.
The second time you guys went, because the first one was great.
Yes.
3 out of the 4 sitting at your table.
Yes.
Got COVID-19.
Two of us tested positive for COVID, and the other one just said, I contacted him and I was like, "Are you feeling ill?" And he said, "Yeah." But he never got tested. He just said that the symptoms were COVID adjacent, but he never got tested. I got tested and my girlfriend got tested, and we tested positive.
Yeah. So you made the right estimation. I mean, if he had the symptoms, he had it, whether he wanted to go no or not. And there's a lot of that, by the way. There are a lot of people who know that they have loss of taste and smell all at the same time and are not otherwise, have a sinus infection or anything, and it's COVID-19, and they're still going out. That's part of the problem.
Exactly. And so we kind of thought maybe the waitress had it.
Yes.
And that's how we got it, because we couldn't figure it out. Later on, after my illness and after my friend's illness, we kind of started comparing notes, and we thought maybe the waitress was the one who had it, because we were careful. Now, granted, we did not have masks on sitting outside.
Right.
Because we thought we were safe.
You thought you were safe outside?
Yeah.
Because that was kind of a general thing that you'd been hearing in the news media and from officials, that, outdoors is much better than being indoors.
Exactly. Exactly. And so I would say that I went to this patio event around the end of June. So let's say June 27th. By July 5th, I started I started noticing the symptoms. And in my head, I was like, oh, this is just a summer cold. I didn't want to admit that it was COVID. But I started off with a fever. I started feeling flush. And I went everywhere to find a thermometer, and there were none in the stores.
You couldn't find them. They were gone in March.
They were gone. People were hoarding thermometers, of all things, toilet paper and thermometers.
Yes.
Right?
Yeah. Like, I don't know what you're going to do with all those thermometers. Right. Yeah.
So I felt like I had, my body was hot.
Yeah.
And then I had an unbelievable headache that I could not get rid of.
So you got that headache that everybody's talking about.
I had that headache.
Can you tell us what that's like? Because when people who have not experienced this, Sandi, hear about the headache, they just think, oh yeah, I've had a headache. Tell us why this is not something you want to play with.
Yeah, it wasn't a normal headache. It was a very sharp pain that just went from the top of my head down, and it wouldn't go away.
Constant.
It was constant. And so I ended up taking, I think, some Excedrin, some over-the-counter medicine, and I felt like it subsided, but it would come back. It just didn't leave.
Yeah.
Completely leave. So it came back. And so I had the fever, I had the headache, and I was telling one of my friends, I was like, I'm not feeling well, and I'm starting to feel a little sluggish. It feels kind of like the flu, so maybe it's like a little summer flu.
Yeah.
And she freaked out, and so she said, I'm gonna bring you an emergency kit. So she has children, so she brought me a thermometer, one that she had never used.
She had one. Okay. Yeah.
Yeah.
Good.
Yeah, I was like, please tell me you haven't used this thermometer.
Yeah. Let's just sterilize it. I don't know. You got kids. I don't know where this thermometer is.
Yeah, I'm like, I have no idea where this thermometer's been. Please make sure you reassure me.
I don't think they do that anymore. I think that's just in our era where the thermometers went into places. So
okay, then we're good. I just didn't want it in my mouth, Dr.
Right.
But anyway,
right.
The thermometer was all I was concerned with. So I took my temperature. It was 102.
Wow.
So then I started getting nervous. So I was like, okay, I immediately reached out to my general practitioner, and I said, "Hey, these are the symptoms that I'm having right now. What do I do?" And so he said, "Don't come in.
Right.
We're gonna
I can
do."
tell you what you will not do. I don't know what you're gonna do, but what you won't do is
I
come in.
know.
Yeah. Yeah.
That's exactly how he.
Yeah.
But he said, "We'll do a virtual meeting," and so we did that. And at that stage, because it was like a day or two before then, my throat started getting really, really scratchy,
Yeah.
and it became like on fire. It was on
Yeah.
fire.
Yeah.
And so by the time I had the virtual appointment with him, he was like, "Okay, he said, 'Are you having trouble breathing?' And I said, 'I don't think so.' So I started breathing deep. I said, I think I'm okay
Yeah. So
with
you didn't have
breathing.
any shortness of breath. It was just these
No,
other terrible symptoms.
those other things that could be confused with the normal flu,
Yeah.
right?"
Yeah.
So I said, he said, "Well, what we're going to do is we're going to order you some antibiotics. We're going to give you a steroid. I think he gave me prednisone, and then something else. I can't remember off the top of my head right now, but he ordered those things for me to pick up. And he said, um, if it's bronchitis or anything that's forming, we'll stop it, before it turns into pneumonia."
Yeah.
Okay.
Right.
My friend also dropped off one of those oximeters so you could
Mm-hmm.
test your oxygen level.
Yeah.
And so I was checking my oxygen, and it was, you know, I don't know what my oxygen should be. So I'm
Yeah.
thinking,
Well, what
okay,
was it? Do you remember what the number was? I'll tell you what it
it
should
was
be.
like 90, it would teeter between 97 and 96.
Okay. So that's not bad. When you start going below 95, we start wondering what's happening because a young, healthy woman should have above 95, obviously close to 99 as you possibly can get.
Yeah,
That freaked you out.
it ultimately got to that. But yeah, I was like, well, it didn't freak me out because I didn't know what your oxygen level should be.
Okay.
So I was like, okay, so it's 96, so I guess that's fine.
Sounds pretty good to you. Yeah.
It sounds good to me.
Yeah. Which
And
you're right. Yeah.
so anyway, I just started taking the medicine, and it wasn't working.
Don't go away. We'll be right back. This episode of the Health Mastery Café is brought to you by Prevent Clinic and by Season 2 of The Good Doctor TV with Dr. Dave. Find The Good Dr. Dave on Instagram, Facebook, and Twitter, and subscribe on YouTube at The Good Dr. Dave.
So I would check my temperature. It was still high. And this went on for days. I was like taking cold showers, trying to get the temperature down, anything to not go to the emergency room. So I was just taking that medicine, and all of a sudden I started feeling like I couldn't take deep breaths.
Okay. So give us a timeline. It was about 8 or 9 days from the time you were at the restaurant to the time you started feeling the symptoms. How many days until you started getting this, what you're about to start describing to us?
So I just remember around the 5th of July, I started feeling
Yeah.
feverish. So I can tell you though, by the 10th of July, I was
Yeah.
in the emergency room.
You went. You couldn't take it anymore. The breathing was the thing that drove you. What was the thing that drove you there?
The thing that drove me was I took my blood pressure, and it was at 186 over 97 or something crazy
Yeah.
like that.
And you
And
don't
so,
have a blood pressure of 186. That's not your deal, right?
no,
This was new for you.
this was new for me.
Okay.
So I went into the emergency room because of that. And when I went in, they said, "Oh, you have pneumonia in your left lung." And I said, "Well, I'm on medication for that. So how is that happening?" And they're like, "Look, you have pneumonia in your left lung."
Right.
Okay.
Yeah. Yeah.
And so they said your temperature is at 101. You have pneumonia in your left lung, and so they immediately tested me for COVID, which was the most excruciating test
Yeah, talk about the headache from the whatever it was. You didn't know what it was at that point. I mean, they have to jab that. Did they do both sides of your nose?
to my brain. They
To your
shoved that
brain. They got little brain tissue.
thing. They shoved that thing to my brain, Dr. Dave. I was like, I had to grab the lady's arm. But anyway, so they took the test and I was just feeling horrible, just horrible. And so they got my blood pressure down. And then they got the fever down. They gave me some medicine. I can't tell you what they gave me. The fever was down to like 99, 98-ish. And they said, go home
Yeah.
and we'll tell you if you have COVID. So I went home.
So
And
let's stop right there because this story is, I mean, I'm on the edge of my seat, as you can see, but just let me go into the mind. What is going on in your brain as you were figuring all this stuff out? You're like, they were about to send me home. What's happening in your head?
what's happening in my head is I have COVID
You knew it.
because I've never had these symptoms before in my life. And I've never had pneumonia. You know, I mean, I'm healthy. I eat organic foods. I boil ginger for tea. I'm not overweight.
Yeah.
I
You
don't have,
are, I can say because I know you, I've seen you. I mean, people can just go to your Instagram and see that you are literally the picture of health. So this was so unusual
yeah,
for you. So
very.
unusual. And what was the thought in your mind? This is COVID-19. What was the next thought?
Well, they put me in a waiting room with other people that had similar symptoms.
Oh no. Like
Yeah,
just a whole group of folks with COVID-19 symptoms?
yeah, it was like 5 people. So I guess that would be a group, but 5 people. And we were just discussing our symptoms and kind of comparing notes at that point.
And each of them had something that sounded like it was COVID to you.
Yep.
They put you in a
Abs-
COVID room?
yeah, it was a waiting room. So I call it a COVID room, but it was a waiting
It
room.
is a COVID room.
So they said, go home.
Tell me what you felt as you were, packing your stuff up, getting back in the car to go home.
I was I was nervous
Yeah.
because I actually asked them. I said, I would like to be admitted. Can you admit me?
You wanted to
Because
go in.
I wanted to go in
That's how bad
because
you were.
I felt bad. And then I've never had pneumonia. So I'm like, I don't know what pneumonia is. I've never had it.
Yeah.
So I don't want my oxygen to drop. That started making me nervous. So my attention to everything heightened. So Dr. Dave, within 4 days, I was back at the emergency
You came
room.
back.
I came back.
What brought you back in 4 days?
Subscribe on YouTube at The Good Dr. Dave.
The oxygen dropped. I could tell from the little
The
oximeter thing on
oximeter,
my
yeah.
finger. It started dropping and it had gotten down to like 92 at that point. It started happening fast.
Mhm.
And so I would start taking these deep breaths and I could feel that I couldn't get as much air in as I once did 4 days prior.
Yeah.
4 days.
Just 4
So
days. Yeah.
4 days. So I went back in. I drove myself to the emergency room. I had all the windows down the car, and just so I could breathe as much air as I possibly could. And then I walked to the desk,
Yeah.
and I said, I can't breathe. I said, I'm having trouble breathing.
Right.
And I know I have pneumonia in my left lung, and I can't breathe. And so the lady, she asked me to put my social security number in.
Right.
She was like, put your information in. And
Yeah.
then I said, can I get some oxygen?
Yeah.
I'm having
Right.
trouble.
Forget about this number. Can I get some oxygen? Yes.
Yeah. And so they brought oxygen around and they tested it. So my thing was actually at 92, but it was actually at 80.
80 what? Give me another number.
80 is what they
No.
said when I went into the hospital. It was at 80. 80.
Oh, when it's at 80, you are not feeling good at all. Were you like turning colors and stuff?
No, I wasn't turning colors. I just could barely talk. I could barely get the words out.
Wow. You couldn't
And
even talk.
no, I kept saying, I can't breathe. I can't breathe. And my voice was at this level. I remember it. And I have a loud voice, you know. I'm soft for you right now, but I'm very boisterous. And so I kept saying, I just can't breathe. I can't breathe. Okay. By then I had pneumonia in both lungs.
Wow.
Okay. It was at the lower part of
The
the
lower
lung,
lobes. Yep.
the lower level. And so they admitted me, and my oxygen kept dropping.
Wow. Despite the oxygen being on with the cannula that goes in your nose, they were dialing it up. It was still dropping.
It was still dropping. It felt like, you know, as the days progressed while I was in the hospital, it felt like I was being suffocated from the inside,
Oh, wow.
you know? So like I'm breathing deep now, like I could just go, it would just be very low
Very
breath,
shallow breath.
very
Yeah.
shallow. Hmm.
And no
And
matter how hard you tried, you couldn't get a deeper breath in.
I could not get a deep breath in.
That's got to be horrifying. To
It was
not be
scary.
able to breathe when you want to.
Mm-mm. It was very, very, very scary. So they kept cranking up that oxygen to the point where, you know, my nostrils were dry
Yeah.
and bleeding, you know.
Mm.
So they said, okay. The point where I got discouraged was when the doctor came in and he said, we don't understand why you're not getting better. That's
Now,
what
were
he
they
said.
giving you medicines and all that stuff at this time? They were giving you steroids and antibody. Did they give you antibody treatments? Did you get remdesivir? Did you get any of that stuff?
So I asked for remdesivir, and he said, my respiratory doctor said that you're outside of the window for that particular drug. So they said, we'll give you plasma.
Okay. Right.
Okay.
So convalescent plasma is plasma that's been extracted from somebody who had COVID before, and you have all these antibodies, and hopefully those antibodies attack your COVID-19. Okay.
But at this point, I can't even roll over in the bed, Dr. Dave,
Why?
without my oxygen dropping.
Wow.
Like if I adjust myself in the bed, I could look at the monitor and see the oxygen would drop. That's when the other doctor came in and you know, after a day or so, and he goes, you're not getting better. And we don't understand why you're not getting better. You've already gotten the plasma, you know, we're giving you steroids, all this stuff. So they ended up saying, we need to send you to ICU. So
Don't go away. We'll be right back. Find The Good Dr. Dave on Instagram, Facebook, and Twitter, and subscribe on YouTube at The Good Dr. Dave.
I actually called my attorney and said, I need you to write up an emergency will.
Wow.
Because I don't know. The doctor said I'm not getting any better. So I don't know what is happening. I don't know.
Not only not getting any better, you are worsening. They don't send you to the ICU unless you are worsening.
Right.
And that is horrifying. Just the call itself kind of gives us the picture of the imagery you must have been dealing with. And to the point where you don't even want a distraction from a television or a phone call from somebody or an email or a tweet or an Instagram or a Snapchat or anything. You wanted to contemplate. What were you contemplating? What were you thinking?
I was thinking, honestly, I was praying. I'm like, Lord, don't let my mother have to bury a child. That's what I was thinking. That was my biggest concern, to be honest with you. I was like, I don't want her to have to experience that.
Wow.
So I would say anybody who's going in, you're by yourself. So you need to have an advocate on the outside that's, you know, checking with the doctors, checking with the nurses,
Right.
because everybody, you know, I'm very outspoken and I couldn't get words out. So she had to, in essence, talk for me.
Yeah.
You know?
Well, and people don't know, and sorry to interrupt, but people don't know that with COVID-19, there are so many restrictions that life is not only not the same outside the hospital, but inside the hospital. You literally have nobody in a room with you except for the medical staff. That's it. So if something goes down and you can't communicate, it just doesn't get communicated.
It
That's
does
not
not
clear to
get
people.
communicated. I finally get to ICU. The nurses would come in and they looked like Darth Vader. Like they had gear.
Dun, dun, dun. Yes, with all of the mask and everything. Yes.
The gear was unbelievable. I mean, they had masks and things that were stretching their skin back, and goggles and hazmat suits and all the stuff on. And so when I woke up, I just see this face against the glass that I'm in. And she's like, "Are you breathing?" This is what they said. I was like, "Yes." You scared the heck out of me, but yes, I'm breathing.
Yeah.
But I started, once I got to ICU, things started changing.
Yeah.
You know, I could see my numbers. They were getting a lot better. My blood pressure was normalizing, my oxygen, and things started turning around.
Wow. How long
Finally,
did you spend in the ICU before you got out? Because they take you from the ICU back to the floor, and from the floor you go home. How many days in the ICU total?
4.
4 total days.
Mm-hmm.
Then you went back to the floor.
Yes,
How long did you spend total in the hospital before they discharged you home?
12.
12 days for a healthy, like super healthy, takes care of herself, young woman from nearly quite serious. I mean, they were about to start escalating the kind of oxygen. You were going to go from a cannula to a mask to the tube, and that's what happens to many people. Their
Yeah.
immune systems take them all the way to the point where no matter what kind of oxygen you put on, it's not
Mhm.
working, and they have to be intubated and put on a ventilator. So you dodged that bullet.
I did.
When you were leaving, give us a sense of what you were thinking when you were walking out of that door.
Honestly, I felt like I was in there for 30 days. It felt longer than 12 days.
Yeah.
And so I honestly felt like I wanted to escape. I wanted to get out of there so bad. I could not get up and go to the side
The
potty thing.
commode. Yeah.
I could not do that. I couldn't do that on my own. I could not do that. So they had to help me do everything, because the minute I would get up, the oxygen would drop. And I don't care, even when I came out of ICU, it would still
It was still
drop.
hard.
It
Yeah.
would still drop. So the day that I could go, take a shower, that's when I realized I'm not ready to leave the hospital, because when the door shut on the shower and that steam came in,
Mm.
I completely
Yes. You
I
kind of
lost my
panicked
breath.
almost. Yeah.
Panicked, lost my breath, and I had to pull the little red cord, and people came running in and got me out of there. And
Wait, so it was that severe. You couldn't get yourself out of there. You had to pull the emergency cord.
Mhm. Because the oxygen, the steam from the shower was taking all of my oxygen,
Yeah,
and
it was taking
the door
place.
had closed to the bathroom. So I was like, there was nothing coming in, no
Oh,
no air. So I had to get help, and so they got me out of there, and they're like, "Okay, we can't discharge you. We got to wait for a little while longer." And then rehab came in. They helped me out one day, and then after that, um, they discharged me. And so they sent me home with 3 units of oxygen, I think.
so
They
they sent you home with an oxygen tank and 3 liters. So you were
three
on three
liters
liters.
mhm,
How long did you have to use the 3 liters?
for 30 days.
1 month.
Yep. After about a couple of weeks of me doing that, I'm thinking, you know what? I'm actually feeling okay.
Yeah.
So
Let me
I,
take this off.
I did.
Yeah.
Bad idea. So I go downstairs without that oxygen and could barely get back up the stairs.
And you're
Without,
there alone.
I'm there alone.
Horrifying.
Yep. So, I kept it on. I
That
kept it on.
was a lesson well learned. Like, I will not be
Yeah.
doing that again. This
Yeah.
is a few weeks into being home.
It was 2 weeks into being home, because I
And
thought, 2 weeks should be enough time. I was still coughing though. I had the dry cough. I had the dry cough the entire month of August. That was the last to go.
yeah. Were you still having the headache and any of the other stuff when you got home, or was that all
No,
gone?
that was all gone. And
Did your appetite ever go away when you were in the hospital, or?
yeah, I didn't eat for the first 4 days. I ate nothing. I had no appetite. And so I lost a significant amount of weight.
How much weight did you lose?
I think about 15 pounds in that window.
15 pounds.
It was rapid.
And so people don't know this, but I mean, you don't have, I mean, like you're a normal size fit woman. To
Yeah.
lose 15 pounds, you were probably losing some protein, some muscle.
Yeah, I took a picture of just my leg and you could see the bone in my
in,
shin.
in your shin bone. Yeah.
Yeah, it was popping up through the skin. And then a month later I took another picture and you could see the stark difference. Like
Wow.
my skin tone was very pale.
Sure.
And the color came back obviously a month later. But yeah, I lost a lot of weight and I'm like 5'2". I'm not gonna tell you my weight, but
Yeah.
I
Normal weight.
lost,
I could tell people you're normal weight. Yeah.
I lost some crazy weight and it was scary, because I just had never been in that position. But after that 30 days at home, um, I felt better. I felt like I could, walk and be off the machine for a while. And oddly enough, Dr. Dave, my mother contracted COVID right at the end of October. So I drove to my hometown to take care of my mom because I'm like, well, I should have the antibodies, right?
Yeah. But that is scary because you don't want mom to have the course that you had.
She didn't have it as rough as I did.
Okay. Did she have to go to the hospital at all?
She did.
Okay.
She went to the hospital and stayed in the hospital for 4 days, but she's 80 years old, so they didn't want to take a chance.
So I think that's a really, really good point. And let's hit that just for a second because there are a lot of takeaways. I'm so thankful that you're sharing all of this because I still think that there are millions, literally millions of human beings in this country, forget about everywhere else, that still don't understand it to this degree. You are young with no pre-existing conditions and you were in the ICU about to, get some escalation on your oxygen. You spent 12 days in the hospital, 4 days in an ICU. Your mother, who is 80 years old with whatever comes with that, but just 80, spent 4 days in the hospital. How's mom doing now?
She's great.
She's doing great.
She's great.
You can't make heads or tails out of this thing, Sandi. We used to, back last year, we were saying all this stuff about what we know. Oh, only the people who are this, that, and the other. No, wrong, right?
Wrong. It's very unpredictable, Dr. Dave, and it works extremely fast. From days to me thinking that I had a summer flu to me being in the ER, it happened so quickly and you cannot stop that. Somebody even said to me, they were like, oh, you waited too late. I'm like, I waited too late to do what? I called my doctor. He said, he gave me medicine. My niece got COVID and that's all she got was prednisone and an antibiotic and she was fine. It just did not work for me. It didn't happen that way. And so I'm like, I don't know what else to say. My body was just not fighting it.
Well, that's so it's the other way around. So I'm going to say two things. One, your body was fighting it, and what we're learning is that part of what COVID patients are experiencing is not the virus per se; it's your immune system's response to it. So all that fluid that you were developing, that was your body trying to fight it, and all of the fallout that comes from your immune system. Okay. That somebody told you, point number two, that you waited too long is that underscore of how we don't understand the virus. That person is thinking that they are okay because if they take these 4 steps, they're going to be fine if they get COVID-19. The virus doesn't care what you think you know or how much you think you've read because nobody knows.
Mm-mm.
right? It was not your fault. You did exactly what you were supposed to do. Your body just played a game. There are some young people who will never, to your point earlier, you never wanted your mom to bury a child. There are some people who, a lot of people, who have buried their children over this.
Yeah.
Young people.
Young. Young.
Young.
Yeah, I agree. Very young.
Here's the other piece that we got wrong.
Oh,
We, as in the medical community dealing with this,
okay.
not you,
Okay.
us. And that was, if you go outdoors, you should be safe. What's your answer to that now? What do you say to the go outdoors, you should be safe thing?
No, that's absolutely wrong. You have to mask up, double mask up now, in my opinion. When you go anywhere, do not allow yourself to be close to anyone without a mask on. It doesn't matter if you're outside or not. I have a friend that loves to play golf, and he was like, golf is the only sport that has been COVID proof. And he got COVID. He ended up getting COVID, but
Wow.
he got it playing golf with his brother. But the fact of the matter is, nothing is COVID proof.
What a great story. I mean, it's like, it is not. It will swim in the air, and if you walk past the air, it's going in your nose, your eyes, or your mouth.
That's
He
it.
got it from playing golf.
He got it from playing golf. Yeah, he
Wow.
sure did. And he just thought, I'm outside, like me. I'm outside. We're not even riding in the same carts with each other.
Yeah. And
We're
still,
walking.
yes.
No.
There are a lot of things we take for granted as we sort of, kind of wrap up here. There were a lot of things that we take for granted. Did it ever come across your mind, like, you know what, I'm never, ever taking this, whatever it is, for granted again?
Oh, absolutely. Absolutely. I mean, I went and got a gratitude journal after that, just so I can just, be appreciative of every day.
Yeah.
I just, you never know when it's your last day. And this thing was moving so fast in my body, and my brain couldn't catch up to what was happening. So, I mean, hence the reason why I would get an emergency wheel. Of course, I mean, I'm constantly appreciating everything at this point. And I want to tell you something that I didn't get a chance to really explain too, is the aftermath, what I've experienced after COVID.
Yeah. Tell us about the aftermath. What have you experienced after it? Yeah.
The aftermath has been very interesting, which my memory is not as sharp as it was. I will say a word or say a sentence, and I will second guess what I'm going to say next. And that's never been an issue
No,
before.
I know you. No, it has not.
No. Okay. The other thing was, I don't know if it was the steroids or COVID or what, but gobs and gobs of hair started coming out. Like I had
You
coming
lost
out
your hair.
from the root. It was lots and lots and lots of hair that was coming out. My hair was super long, and then I had to cut it off because it was starting to shed so bad, Dr. Dave. It was really bad. And that became depressing. I was like, what's happening
Yeah.
to me after this virus? So one night I felt like I was almost having some kind of either anxiety attack, or my heart was racing fast. And so I ended up going back to the emergency room months after I had come back from taking care of my mother, because I was fearful that I'm like, did I develop a blood clot? Is that happening after this? Or is my heart okay after this? Are my lungs okay after this? So I think my paranoia got the better of me. So I said, just let me go into the hospital and let them check everything. So they did a CT scan. They did blood clot scans of my leg. They did an echocardiogram.
Yeah.
They checked my lungs, everything. I'm like, I just need you to check me from, guess what? The rooted to the wet, doctor.
That's right. Hey, say it. You can say it. Rooted to the tutor. Absolutely.
I like, just check everything.
Yeah.
And so it turned out that there was nothing else going on, thank God.
Right.
But I'm like, why is my hair falling out like it is? I just didn't understand it. And one of my other doctors said, it was likely the steroids that they gave you because it was a very, very strong. But I don't know. I still don't know. And again, one of my friends that I'm going to introduce you to is one of the long haulers. So he's still trying to get over it from July of 2020.
Still now.
Yep.
Still now. Yeah.
He's still not back to work. He's extremely drained. He can't, his breathing is still shallow sometimes, and he still has a cough, believe it or not.
Yeah. No, I do believe it. I see it every week. I've got long haulers. I have people who had a little bit of symptoms at first, a gap, and then now are having heart symptoms, literally.
See?
Really high blood pressure, chest pain, shortness of breath. Didn't have it with the COVID-19. Young man just today, I just had a loss of taste and smell. 3 months later, he's coming to me for shortness of breath, chest pain. This guy's young, 34 years old. You don't know this virus. That's the message. Sandi, I really thank you for sharing this. This is going to be so helpful to so many people. And I really, really thank you for your time. Blessings to you.
You're so welcome, Dr. Dave. Anything for you.
This episode of the Health Mastery Café is brought to you by Prevent Clinic and by Season 2 of The Good Doctor TV with Dr. Dave. Find The Good Dr. Dave on Instagram, Facebook, and Twitter, and subscribe on YouTube at The Good Dr. Dave.